So it's 6 months since we did the nose.
Yeah.
How was it? How has it been?
It was okay.
Was it very painful?
No, it wasn't painful. I mean, maybe the first minute, but after injection, the pain was gone. So, actually, without any, if I didn't touch or didn't do anything, I didn't feel any pain.
So it was just for a very short time, and you didn't have to take painkillers after that?
I didn't have to. It was okay. Of course, if I touched it or hit it by a coincidence, then it would hurt. But other than that, I didn't have to kill the pain because I didn't feel it.
What about breathing?
In the beginning, it was difficult. The first few weeks, I was struggling with the nose because I couldn't breathe. But it might have been related to me having a dog in the beginning, a puppy, and I'm allergic, so I think that it might be the reason. And after I think a month or a month and a half, it stopped and I started breathing well.
Okay, and how long did it take before you actually liked the nose, the shape of it, and because in the beginning it was very swollen?
So yeah, it took me some time before I could say to myself I like it like 100%, because yes, in the beginning it was swollen, it was a little bit raised up. And
the tip was higher?
The tip was higher, and maybe...
How was it like?
Like this, yes.
Like that?
Yes,
okay.
yes.
And
raised.
you didn't like that?
Yes, and here maybe it was a little bit like lower, but after 2 months maybe it started build up, so it became more straight, and then I could see the real shape, and I was happy with it.
Okay, so in the beginning, like the first 1 or 2 months, the tip was higher?
Yes, but it was gradually going down, and it was kind of shaping into the right shape.
And also, you said it was a little bit more curved, but now it has built up a little bit more, so it's more straight now.
Yes, exactly. And this is actually how I want it to be straight.
Yeah, it's we had a look at the simulation we did. Let's see how close I managed to get. Let's see.
Here I am.
This side. There it is. Okay. So this is before. And then we did the simulation like that. Quite straight, and the tip not very high. Let's have a look at that. So turn a little bit. It's quite similar. It's very difficult to get it exactly like the simulation, but the simulation tells me more or less what you want, and then I try to get as close to that as possible. So you work as a psychologist, right?
Yes.
So how has this process with the operation been for you psychologically?
Definitely there is tension before operation, and there is kind of a unrest, yes. For me it was unrest related to being completely out of control for the moment of operation. You just don't know what's happening to you, so you have to trust that you're in good hands. And then after that, it was kind of adjusting to the new look, which takes, I think, which needs to take some time. For me, it was the time that before I finally said, okay, this is my new face, I like it. Yeah.
And after the operation, were you very worried when your nose was thick and the tip was high, and how did you cope with seeing yourself looking so differently?
I think I didn't have that much problem, to tell you the truth, because I was informed by you that everything will reshape, and I know that because I also work with people who are operated, that it takes a lot of time before organism and tissues adjust to the final shape. So I was patient, and I knew that this is a stage, one of the stages in this process, that it's not like fixing a car, that immediately you arrive at the result, but it needs some time, and you have to be patient. And once you make this decision, you have to know that it will take time, and it pays off.
So why did you want to do this rhinoplasty, this nose operation?
I wasn't happy with the hump. I was I didn't like the profile of my face. I always had this feeling that maybe someone is looking and judging my looks, and that I don't look too good, and I wanted to be more attractive than I am. So the nose was the main issue.
From the profile especially? From
the profile especially, yes. I didn't like it. And when I was smiling or laughing, the nose would go even lower, and the profile was too sharp.
So what happens now if you smile? And stop smiling? And smile? It looks like it's not going down.
Yeah.
Okay.
Yes, I feel more self-assured now and more comfortable with my looks. And my friends and the people in my family, or just the people with whom I work, they say that sometimes they stare at me and they say, "Oh my God, you look so beautiful now."
Actually, you look younger and cuter as well, I would say. But you also told me that after surgery you were a little bit uncomfortable with all the attention, because everybody looked at you, and you didn't like to have all that attention.
Yes.
They wanted to have a look at your nose, and
yes, I didn't feel good with this attention, because I was like in the middle of attention of many people, and in Poland they would go up to you and tell you straight whether they like it or they don't like it. Yes, so majority of them, they liked it very much. They say, "Oh, finally your nose fits your face." But there were some people who would just come up and stare at you and say, "Oh, I like the farmer Patricia." Yes.
So how did they motivate that they liked the nose when it was bigger?
I don't know. They maybe one or two persons said that. Yes, but I didn't care, because for me, it was my own opinion that matters most. Yes. So,
okay. But now it has been 6 months. Has it settled down now, or do still people talk about your nose, or is it more calm?
It was first 2 months or first 3 months. It clearly needed time for them to adjust to my face. It was like looking at me, and some say, "Oh, you got thinner," or you need to eat something. Or
they thought you lost weight?
Yes, they thought, yes, I lost weight. They noticed that something changed.
Did you lose weight?
No, I didn't. They noticed that something changed, but they didn't know what at first. And then I told some of them that this was the operation. So,
okay.
So when you go through these first months, then everything comes back to normal. They adjust to your new look, and everything is all right.
Okay, and I understand you work in a hospital with patients that are going to go through surgery, and you help them psychologically.
Yes.
But now we're not talking about cosmetic surgery, we're talking about cancer operations and big operations.
Yeah. So this is difficult. This is a difficult process, difficult before and after. And people have huge hopes that it will help them to recover. But sometimes the body recovers faster than the mind. And this has to be fixed mentally and from the emotional side, because this is a huge change for many people, both for the patients and for the families. And this is when I come and try to explain and try to build their courage and patience, and believe that, yes, this can work out for them.
So even if a cancer operation is successfully and the patient is treated, still they can collapse almost mentally, because it's a hard thing to go through.
It's a very hard thing.
And
to
then
go
you
through.
come there and help them to recover psychologically.
The very information that they have cancer is a shock, and then they need time to kind of get to grip with it. Yes, and then the solution comes. Yes, we can operate you, or no, we cannot. You have to go under different treatment. So they have to build up strength to go through the operation, to kind of cope with the fear, cope with many questions they have. And after the operation, there is this long process of kind of getting back to normal. And if this process is prolonged because of some complications, then usually the mental power goes down a little bit. And this is the moment when they need this kind of a boost of energy to withstand it all. Sometimes they need more time, sometimes they need less time, but definitely it's for everyone it's a huge life shock.
So usually how long time does it take for them to recover psychologically after operation?
This is a difficult question, because each case is individual. For some of them, they try to quickly cut their awareness from it, and they just quickly try to forget about everything and focus on every life like duties and demands. And some of them need more time, especially if at the same time they cope with some other life issues and problems. So it depends.
So are we talking about usually months, or it can take years?
It can, usually it's months, and even if everything is okay, there's always somewhere there on the back of their minds this fear that it might return. So they kind of live with the hope that they will be alright, but there's always this few percent of doubt and anxiety that it might return.
Okay. So now you have been a patient yourself. Usually you work with patients.
Yes.
Going to go through surgery. Now you went through surgery yourself. Has that helped you in your work to be a patient yourself?
Definitely.
In what way?
I can understand fear better, especially when I talk to people and they tell me that they are afraid. Now I understand what it might be. My fear wasn't a fear for life, it was a kind of a different fear. But definitely this fear connected to being put to sleep and not knowing what's going on. This is something that I've experienced, so now I can relate better to what actually they are feeling. And
so was it like you just had to trust the anesthetist that you're going to sleep and wake up? You just had to trust that the surgeon was going to do a good job?
Yes.
And this was a fear to leave that responsibility away and not have any control?
I trusted the specialist, but there's always this 1%, 2%, what if something goes wrong, yes? And you may not wake up. And this is something that my patients tell me. If I ask them, what are you fearing mostly? They say that I may not wake up. And this is something here rooted deep in the mind, that it might happen. So now I can somehow relate to it. And also this kind of a fear, how it's going to be, whether it will be easier to cure or more difficult to cure. It's good to be in someone's shoes if you work with them.
Yes. If you have had the experience yourself, it's easier to understand how other people experience something.
Definitely.
Yeah. Okay, so it wasn't just you just didn't get a smaller nose, a nose that you like better. You also learned something that you can use in your work.
Yes.
Okay,
yes.
Very good. Okay, it was very nice. I'm happy you came back, even if you came all the way from Poland, and I'm happy you gave me this interview, because going through rhinoplasty is very difficult psychologically, and I think it's good for other patients, future patients, that they can see how you look at it. Also, you have this professional view because you're a psychologist. So I'm very thankful that you do this.
I'm very
interview
grateful
for
to
me.
you. Thank you.
Okay, and thank you for the flowers as well.
Thank you.
Okay.
Thank you very much.
Okay. So, but you will come back even after a year? You can come back if you like, and we can have another. The nose will not change very much, but perhaps a little bit. And if you discover something, I understand you're happy now, but maybe in the future you discover something small, you can just contact me.
All right.
Huh?
All right.
Okay.
Well, thank you.
Thank you very much.